2017 and wondered pondered about many things like how did Trump manage to become president? And Serena Williams able to win a Grand Slam in tennis being 2 months pregnant. Well, this week the House of Representatives has voted yes to the controversial American Health Care Act that is being used to replace Obamacare. Our news channel has considered this to be an important issue to the American public and has taken upon us to do intensive research to inform the public about this act. We have a lawyer on RNN who is an expert on healthcare and will talk about this controversial change to American healthcare. We have Ms. Sarah White who will answer important questions about the American Healthcare Act. Welcome to RNN.
Thank you.
So, what are the provisions of the Republicans' new healthcare bill?
Well, there are many provisions that they had made, such as insurers can impose a 30% surcharge on consumers with a lapse in coverage of more than 63 days, no tax credits for out-of-pocket expenses. States can choose to expand Medicaid eligibility but would receive less federal support for those additional persons. Let states impose work requirements on Medicaid requirements. Insurers can charge older customers up to 5 times as much as younger customers. It repeals all the 4 taxes originally imposed on the Affordable Care Act, such as the 3% tax on investment income, 0.9% tax on individuals with an income higher than $200,000, 2.3% on tax medical devices. States can apply for waivers exempting insurers from the essential health benefit requirement. States are permitted to opt out of mandating coverage for pre-existing conditions. Dependents are able to stay on the health insurance plan until age 26. Insurers may be able to place annual and lifetime limits on individual coverage. And federal payments to Planned Parenthood are going to be blocked for 1 year.
So, what is the major difference between this new healthcare plan versus the Obamacare?
Well, this new healthcare bill has a lot of major differences. The new bill got rid of out-of-pocket expenses and the annual limit on copays and coinsurances. It expanded the amount that insurances can charge older citizens over younger citizens from 3 times the amount to 5 times. The last major change is the funding to Planned Parenthood, which is going to be blocked for 1 year. This means that Planned Parenthood will not be supported by the federal government and therefore will have to come up with the money for their programs by fundraising. However, this new bill got rid of 4 taxes that were set up by Obama.
Has the bill been passed through the House of Representatives and the Senate?
Well, it has only been passed through the House of Representatives on May 4th, 2017, but it has not passed through the Senate. The Senate is looking to make substantial changes to this new bill.
What fear do conservatives and insurers have about this bill?
Well, conservatives complain that the bill does not fully repeal Obamacare and that many provisions are too similar to the health reform law. Insurers worried that Republicans would cut federal support for Medicaid and tax credits, leaving many of their customers without coverage.
What arguments are made for and against the bill?
Well, proponents of the bill argue that it would save the individual health market from collapsing. The legislation would create a patent-centered healthcare system that provides Americans more choice, greater control, and lower costs. Whereas opponents said it could reverse the gains in coverage that have been made since the Affordable Care Act was enacted in 2010. The Congressional Budget Office found that 24 million fewer people would be insured by 2026 under the GOP bill. The Congressional Budget Office estimates do not include the most recent amendment to the bill, though.
Okay, thank you so much, Ms. White, for being RNN.
Thank you for having me.
Both Democrats and Republicans are seen arguing and not being able to agree on how detrimental this new health care act would be on people. You know what? It reminds me of my first graders fighting over the same broken toy that they can't agree to let go of, except that broken toy is a broken healthcare system that seems like it's ready to blow up. Luckily, I was able to get an interview with 2 representatives of Congress over the thoughts on the new healthcare act. Good morning, America. Here with me today is Democratic Senator Blair Zakiri and Republican Senator Christina Colucci. Thank you for coming on the show today. Now, Blair, what problems do you see here in the American Healthcare Act?
Well, Evelyn, you see there are various reasons for why the Democratic Party does not support Trumpcare. For instance, the American Health Care Act would hurt Medicare. As part of Obamacare, the federal government increased payroll taxes to help fund for the Medical Care Trust Fund. The fund is used to reimburse hospitals when seniors come in and need treatment. Trump Care takes away from these taxes, and as a result, the Medicare Trust Fund would go broke in about 4 years earlier than currently projected, in 2025 instead of 2029. This would force hospitals to either swallow the costs themselves or turn away Medicare enrollees.
How do you feel about the Republicans' new bill, and what aspects do you like the most?
Well, I think the new plan is a step in the right direction for the American healthcare system. There are several aspects that I think are the best, such as the repeal of Obamacare subsidies, the repeal of individual and employer mandates. It creates more generous health savings accounts. It bans excess tax credits from going into health savings accounts. It defunds Planned Parenthood. It reduces the income threshold for deducting medical expenses.
You know, some people think that Obamacare was great for them. Why do you think Obamacare is such a bad plan?
Well, to me, Obamacare just doesn't work right. There are some problems with it, such as 30 million people bought private health insurance, and insurance companies canceled many of their plans because their policies didn't cover the Obamacare's 10 essential benefits. Another 3 to 5 million people lost their company-sponsored healthcare plans, and an increased coverage raised overall healthcare costs in the short term. The Obamacare taxed those who didn't purchase insurance. In 2013, Obamacare raised the income tax from 1 million individuals with incomes above $200,000. It also raised taxes for 4 million couples filing joint returns on income exceeding $250,000. The rate increased from 1.5% to 2.35% on income above the threshold. They also pay an additional 3.8% Medicare tax. Starting in 2013, families could only deduct medical expenses that exceed 10% of income. Before, they could deduct expenses that exceeded 7.5% of income. And in 2020, insurance companies would be assessed to 40% excise tax on Cadillac health plans. These are plans with annual premiums exceeding $10,200 for individuals or $27,000 for families.
We have now heard the flaws of each act from both parties. Laura, does it have a major effect on any other groups of people in the United States other than the elderly?
Yes, Evelyn, it does. The bill also defunds Planned Parenthood, as Christina said, which many of you know is a nonprofit organization that provides reproductive health care in the United States and globally. Cutting off the funding is not only unpopular with the Democratic Party, but with the majority of American citizens today. A poll by the Washington Post in January found Americans opposed defunding Planned Parenthood by a 62 to 31 margin.
That does sound like a problem that our government will somehow have to address. Do you have anything else to say about Trump Care?
I don't think the bill will pass. We believe accessible, affordable, high-quality healthcare is part of the American promise, and that Americans should have the security that comes with good healthcare, and that no one should go broke because they get sick. In Obamacare, we enacted landmark reforms that were already helping millions of Americans, and more benefits would come soon.
Do you have anything else to say about Trump Care?
Well, we believe in a patent-centered healthcare system, which is based on free markets, fostering competition and driving out healthcare costs down. We believe that healthcare system that is run by the government will reduce both the efficiency and the standard of care. So in my opinion, I think this is a great plan that incorporates all these ideas.
Thank you, ladies. Okay, America, you heard it first here at RNED. Thank you for coming to the show, Blair and Christina. Well, that conversation was very interesting and informative. Many Americans were complaining about the new Healthcare Act, claiming that Republicans have had their wallet at heart and are taking money from interest groups and businesses that profit off health care. I have a representative from AARP that will talk about this issue. Lisa March Ryerson is the president of the American Association for Retired People and has been very active in opposing this bill. She is with us today to discuss and elaborate on the issues of the bill. We actually have Lisa on the phone from Washington who will answer questions. Welcome, Lisa. What are the biggest issues with the AARP associates with the proposed American healthcare bill?
The American Association for Retired People has big issues with the fact that this bill weakens Medicare, which will cause higher prices for senior citizens wanting to get health care. This new bill is also focused on insurance companies getting money from their customers. Raised prices for older Americans pose a big problem, which is the major provision of included in this bill. What the lawmakers seem to neglect is the fact that retired people cannot afford to have high insurance prices.
What are the largest threats with cutting Medicaid funds?
Medicaid cuts can harm threats to people of all ages and risk their health. In total, 17.4 million children and adults with disabilities would be impacted negatively by this bill. Seniors who need assistance in living would not be able to receive the needed help. In total, this bill would lead to 24 billion people losing their health care in the next 10 years. This bill is designed to help insurance companies, while those who are old and are living with pre-existing conditions or have lower incomes will not benefit at all.
Thank you so much for your opinion and advice. It was great to talk to you, Lisa. I am currently in the city of White Plains, New York, and talking to Sally Smith, who has been living here for her entire life and has been benefiting from the Obamacare program for over the past years. Now her health insurance is endangered with the proposal of a new Trump care bill. Sally, how are you feeling? Would you mind sharing your opinion on the bill with our viewers?
I mean, I don't really know what to say. My daughter was born with diabetes, which is a pre-existing condition, and now I don't know what we're going to do about it and how we're going to pay for all the things she needs to survive. Right now, we are depending on the help of Obamacare, and having that taken away from us is keeping my husband and myself up at night.
Do you think there can be improvements done to Obamacare?
Oh yes, definitely. But what they are proposing right now is not going to help anyone except for insurance companies and the rich people.
Have you taken any actions to express your concerns, in your opinion?
Yes, I have called our senators and representatives in their offices to persuade them to oppose the bill.
Would you recommend others to do the same?
Definitely. When you call the offices of the representatives, it is usually recorded in their records, which means that they will be able to see how many people called in favor of the bill and how many oppose it. At this point, I believe this is the only way to reach politicians in Washington and stop this bill. For me and many other citizens, this is a real problem, especially because our personal lives depend on it. Just because the Republicans hate Obamacare, they should not try to punish all of us and risk our health to get back at them.
Thank you so much for your opinion and have a good day, Ms. Smith. Today, we have heard from a lawyer, an AARP representative, a Democratic and Republican senator, and an ordinary citizen, which all provide important insight in the American health care bill. This is a very controversial topic, and the media has been prominent in covering and analyzing the reactions of politicians and citizens. Whatever happens, RNN will keep you updated with the latest news. Thank you for watching.